Funding for Yale Cancer Answers is provided by Smilo Cancer Hospital. Welcome to Yale Cancer Answers with the director of the Yale Cancer Center, Dr. Eric Weiner. Yale Cancer Answers features conversations with oncologists and specialists who are on the forefront of the battle to fight cancer. This week it's a conversation about cancer survivorship with Amanda Antonelli. Here's Dr. Weiner.
Can you just start off telling us a little bit about you?
Sure. I was born in New Haven. I grew up in Cheshire, Connecticut. Mom, dad, brother. I went to Trinity College in Hartford, graduated with a degree in psychology, worked in nonprofit for a few years, and eventually got my master's in social work and went to work in medical social work. In my free time, I am a mom to a 9-month-old, wife to my husband, and we love the Yankees.
Oh, wow. And I seem to remember you also have sort of an athletic side, too.
I do, yes. I played varsity volleyball at Cheshire High School.
And since the audience can't see you, can you tell us how old you are?
Sure. I am 38 years old.
38. Okay. So you are someone who has had to deal with cancer off and on more times than you would like in your life.
Yes.
And how did that all begin? How old were you when you first had a diagnosis of cancer?
So I was first diagnosed when I was 11 years old. It was 1998. Woke up one winter morning with a bump on my leg. And we really weren't sure what it was. We did the normal, go to the doctor, get it looked at. When it wasn't going away, we went to the emergency room to get ultrasounds and scans, and still a lot of uncertainties. Eventually,
and this bump was where?
My left calf.
Left calf, okay.
I was actually getting ready to go to softball practice that morning, and kind of thought to myself, did I hurt myself? Did I get injured? What is this? Eventually, needle biopsy, open biopsy, lots of tests and scans later came back as rhabdomyosarcoma, which is a cancer of the soft tissue. The plan was to do chemotherapy and radiation, followed by surgery to remove the bulk of the tumor. When the chemo did not shrink the tumor, they went in earlier than expected to try to remove what they could, and then more chemo to try to shrink what was left. So it was about a whole year of treatments, radiation, surgeries, infections, ultimately culminating in being declared cancer-free and then unfortunately relapsing about a year and a half later, which led to the amputation of my left leg above the knee.
Relapse was in your leg?
Yes. Luckily, the rhabdo never spread. I know it is generally a very aggressive cancer, and I always considered myself very lucky knowing that it never went anywhere other than my leg.
So, it's hard to remember back, I'm sure, but what was it like being 11 and getting chemotherapy?
You only really can comprehend so much. I feel like when you're 11 years old, I knew what cancer was, kind of. Basically, what I understood was that I felt really sick all the time. And there were things that I couldn't do anymore. I couldn't go swimming in the ocean. I couldn't see my friends as often as I wanted. My risk of infection was high. All of these words entered my vocabulary, like neutropenia and white blood cells and things that I never had a need to know, but all of a sudden were very focused on and making sure that my counts were up. And it was, I would say, more sad than anything else. I felt more sad, even like since then. I don't think I've ever been as sad as I was when I was going through chemo.
And were you worried?
I was. I didn't know what my prognosis was. I was never informed of what that would look like. I knew that I had stage 3, but short of that, I had no idea what to expect. I was scared. I remember saying to my parents, this isn't worth it. Like whatever this is, just don't make me do this anymore. Not really fully grasping that not doing it could potentially mean dying.
And did you understand at the time that the cancer, even if what you received was tolerable and you got through it, that the cancer could potentially threaten your life?
I think maybe in the back of my head, on some level, I knew. I think most young people, when they go through cancer, they go through what I call accelerated maturity. And you kind of have to come to terms with a lot of really heavy things very early on in life. And you start to have to ask yourself questions about death and dying and when you're young. And an 11-year-old shouldn't be thinking of those things. But it's an unfortunate thing that, whether we want it to or not, starts to creep into our brain, because even at 11, you know of people's parents or grandparents who have died of cancer. So you know it's a possibility on some level.
And so you not only majored in psychology, you became a social worker, and you have spent some amount of your adult career working in pediatric oncology. So now, with that lens, do you think anything should have been done differently in terms of what you were told or not told? And I'm not for a moment in any way being critical of your parents, doctors, anyone, but is there any other thoughts that you have now about how you would do it differently?
I mean, it's so hard, especially looking back at from like an 11-year-old's lens. I will say something that I tried to do. I worked most recently at the Yale Pediatric Hematology Oncology Unit with young adults with cancer. And a big part of what I worked on with them was allowing them to feel validated and heard. So often young cancer patients are told, just keep your head up, just be positive. And that can be a great message, right? But ultimately, you're minimizing the hard, sad thoughts that they're having. So I think if I could go back, I would just say, hey, just acknowledge what I'm going through is really hard, and let me know that it's okay that I'm sad, that it's okay that I'm struggling. Because there was almost this pressure, and not from anyone in particular, but there was this pressure to be positive and happy and all the time, and put on this face even when I was miserable.
Do you have brothers and sisters?
I have an older brother, yes.
Was he affected by this?
You know, he is 6 years older than me. So he was a senior in high school when I was going through this, and we weren't super close at that time. Age gap. Later on, as you know, you get older, that age gap tends to shrink a little bit now that we're both, he's in his, he's 44 and I'm 38. He said to me that he was never worried about me. And then he backtracked and said, not that I didn't care. He said, I just knew you were going to be fine. And of course it affected him. I know that he wrote his college essays about me. I don't know what he wrote. I have never been allowed to read those. But I do know that he was affected in ways that I'll probably never understand. But I know that he even took a year off in between high school and college and did a post-grad year to be closer to home. So he was affected. He's a very, like my dad, very stoic man, and isn't always as outwardly emotional. But I do know that he, again, cared so deeply that he could kind of sense that I was going to be okay.
So our listeners are going to be a little surprised by what they hear next, but this was by no means your last episode of having cancer.
Unfortunately, no.
And we're going to jump forward, but then we're going to go back a little bit. But just tell us, how many different cancers have you had?
I've had 6 different types of cancer.
And those 6 different types of cancer are all related to the fact that you also have a inherited abnormal gene.
Yes.
That has made you predisposed to these cancers. And
yes.
When did you find that out, and what is that?
So in 2013, I was diagnosed with something called Li-Fraumeni Syndrome, which basically means that one of my 2 tumor suppressor genes does not work. all humans are born with two. I was born with one working copy of that gene.
And that came from either your mother or your father?
Actually, I'm a de novo case, which means my mother and father were tested negative, and I was a brand new mutation at conception.
This is a what would be called a spontaneous mutation.
Yes, exactly.
So somehow, as you were evolving from a few cells to a few more cells,
yes,
there's a cell that lost that copy of this particular gene.
Yes.
So that diagnosis in 2013 of Li-Fraumeni, which is, as our listeners may know or more likely don't know, is a very rare syndrome. There aren't a lot of people like you out there in the world. That occurred, that diagnosis, after your second cancer, third cancer, fourth cancer? When did they think to test you?
That was in between my fourth and fifth cancer. I had made the decision on my own to be screened for it. I was in my late 20s at the time, and it had been mentioned to me, I think when I was 18, after my third cancer, that this is something that you might have. But I wasn't ready to kind of deal with that information just yet. I think I was young, and it was not, I think, a weight that I was ready to carry. At 27, knowing that it is hereditary, I wanted to know in case I decided to have children, and knowing that if I had it, that I could pass it on.
And we're going to have to take a break in a minute, and then we'll be back. But before we do that, could you just tell us what number 2 and 3 cancers were?
2 and 3, 2 was chondrosarcoma in my rib.
So another sarcoma.
Another sarcoma. And 3 was leiomyosarcoma, another sarcoma.
Yet another one, yes. And did each of those require chemotherapy as well, or just
Luckily,
surgery?
they did not. It was just surgery.
And they were found because you had a symptom? You noticed something? You weren't being screened, presumably.
I was being screened, actually. Okay. Before they did the amputation, they scanned me from head to toe and found the chondro.
Okay. And the leiomyosarcoma?
That was, I could actually feel a lump in my abdomen. So we went and had it. It looked like a cyst. They tried to drain it, wouldn't drain. And it was a tumor.
So we'll be back in just a minute. We're going to talk about numbers 4, 5, and 6. We're going to talk about your decision to have a child. And we're going to talk about how it is that you just keep carrying on.
I try.
So we'll be back in just a minute.
Funding for Yale Cancer Answers comes from Smilo Cancer Hospital, offering spiritual care to patients and caregivers seeking peace in the midst of their cancer journey, while respecting the philosophies, spiritualities, and religions of patients and caregivers. SmiloCancerHospital.org. It's estimated that over 240,000 men in the U.S. will be diagnosed with prostate cancer this year, with over 3,000 new cases being identified here in Connecticut. 1 in 8 American men will develop prostate cancer in the course of his lifetime. Major advances in the detection and treatment of prostate cancer have dramatically decreased the number of men who die from the disease. Screening can be performed quickly and easily in a physician's office using 2 simple tests, a physical exam and a blood test. Clinical trials are currently underway at federally designated comprehensive cancer centers, such as Yale Cancer Center and at Smilo Cancer Hospital, where doctors are also using the Artemis machine, which enables targeted biopsies to be performed. More information is available at yalecancercenter.org. You're listening to Connecticut Public Radio.
Hello again. This is Eric Weiner with Yale Cancer Answers, and I'm here with my guest, Amanda Antonelli, who's talking about her life as a 6-time cancer survivor at the age of 38, although the 6th was at an age somewhat younger than 38. So just quickly, can you tell us about cancers 4 and 5?
Sure. Cancer number 4 was a very small lesion on my kidney called clear cell carcinoma, which was removed with surgery, no chemo required. 5 was breast cancer, and that was a more serious diagnosis, which required multiple surgeries and chemotherapy. And I think what a lot of people may not know about Li-Fraumeni is that because of my predisposition to cancer, radiation really is not an option for me. Because radiation can be a carcinogen. It was not breast cancer would normally require radiation. I did not get it. It was chemo and a prophylactic total mastectomy.
All right. And when you were tested for Li-Fraumeni between, if I remember correctly, cancers 4 and 5?
Yes.
When you found out that you did have this gene mutation, were you surprised?
On some level, no. I think there was a part of me that knew that this was likely.
Your life was a little different from the average person in their
absolutely,
early 30s.
Absolutely. I mean, to be 27 and have 5 cancers, or at the time it was 4, but I knew that it would be even more rare for a person to have 4 cancers and not have a mutation.
Right.
So I think when I got the results, I was not super surprised. And the way that I looked at it was, well, at least now I know, and I'm going to be monitored for the rest of my life.
So you weren't devastated by having the mutation?
I was not devastated. I was worried about what that meant for fertility. But for me in that immediate moment, it was, well, at least now I know that any cancer they find is likely going to be in its early stages.
Yep. So cancer number 6, if I remember correctly, turned out to be ovarian cancer.
Yes.
And that, of course, has the potential to compromise your ability to have children.
Yes.
So tell us a little bit about the treatment for cancer number 6 and how it all came about that during the course of that cancer, you decided you were going to go ahead and have a child at some point, and how that all played out.
Sure. So I got married in May of 2022, and about 3-4 months after that, started being symptomatic in my abdomen, bloating, swelling, things like that. Ultrasound revealed pretty sizable, what looked like a cyst. And my doctor, who's amazing, Dr. Ratner, went in and removed the cyst, and it tested positive for ovarian cancer. From there, we knew that chemo would be on the table and likely a total hysterectomy would be on the table. My husband and I hadn't even been married a half a year, and we wanted to try at least for a kid. If it works, great. If it didn't, we knew that we would be perfectly happy being just the 2 of us. So we went through and did fertility preservation. So I worked with Yale Reproductive Endocrinology and Infertility to do an egg retrieval, and then ultimately an embryo freezing, along with full genetic panels not genetic panels, sorry. We did PGT-A and PGT-M testing on our embryos, which tested for Li-Fraumeni as well as any chromosomal abnormalities. Of the 6 embryos that we sent for testing, we got 3 that were high quality and negative for my mutation. My doctor agreed to postpone the hysterectomy until after we tried to implant one of the embryos. But she was very concerned given my history. She really only said, I'm going to give you this one shot. And
meanwhile, you had already had chemotherapy.
I'd already had chemo.
You had had chemotherapy for the ovarian cancer because this ovarian cancer was a somewhat more advanced cancer than some of your previous diagnoses.
Yes.
And there you were in, I'm guessing, 2023. having had chemotherapy for ovarian cancer, holding on to your uterus with
For dear life.
and with a life in it.
Yes.
And then you had a child.
So our implantation was successful, and I gave birth to my son, Matteo John Antonelli, on February 27th, 2024.
And then did the uterus come out?
It came out. Full hysterectomy, omenectomy, everything came out that could have had the possibility of having any cancer cells in it or on it or attached to it. And luckily, everything came back completely clear and clean. And here we are.
So I want to ask you a number of different things. In fact, I have an endless number of things I want to ask you, and I'm going to have to limit myself.
Sure.
So here you are, status post-6 cancers, being screened probably in a number of different ways for the rest of your life. How do you think about that?
It can be exhausting. Sometimes I have thoughts of, I just wish I could be a, quote, normal person and not have to go to a doctor feels like every other week. And, my training in psychology and social work allows me to, look at those thoughts and say, like, no, those are very valid thoughts. But at the end of the day, this is my life. I always say to myself, all we can do is the best with what we're given. And this is the life that I was given. So I try to do my best. Not that I don't have moments of, not even weakness, but moments of frustration or anger or sadness. Of course I do, but it's all relative to, I guess why we're here, and who knows why we're here. Not to get too existential, but in the grand scheme of life, and again, my son also now gives me so much more meaning.
So I often tell patients that the best predictor of doing well in the future is doing well in the past. Given how you've done with these 6 cancers, I think you're going to live to be about 250. I mean, the story is sort of astounding. Can you talk for a minute or so about your relationship with the healthcare teams you've had, with doctors and nurses and others? I've heard you mention on a number of occasions the positive relationships you've had. What's that been like, having to deal with so many different doctors?
I mean, in social work, of course, our job is to deal with people. But even before I was a social worker, of course, my life was full of doctors. And I think I could always kind of read people pretty well. So I learned to adapt to whoever was kind of treating me at that time. And I come from a nice family. I'm a nice person. I think we're pretty easygoing. So I don't want to cause too much. My dad will tell you otherwise. My dad was not always the friendliest to the doctors, I will say. Sorry, Dad. But
he had to protect you.
Of course he did. Absolutely he did.
He was your advocate. He was the person making sure that they were doing their job every single minute of the day.
Yep.
And going over and beyond.
Yep. He was, the Papa Bear. And as often as he could, he worked when I was sick, but he worked in New Haven, so he would come after work if I was impatient and stay with me. We'd watch. That's how I actually developed my love for baseball. Was one of the only channels we got in the hospital were the Yankee games. So he and I would watch those together. But I don't know. It's getting along with people and dealing with people has, I guess, always kind of come easy for me. But it is an exhausting. It can be exhausting. Just feeling you have to be on all the time.
And as wonderful as many of the doctors and nurses and others and social workers and pharmacists that you've dealt with, I have no doubt, knowing something about healthcare experiences in hospitals and clinics that you have at some point in time come across someone who was a little less empathetic?
Absolutely.
Or who, not that you want a lot of sympathy, I suspect, because you don't, but maybe a little acknowledgement. And when you don't get that acknowledgement, that must feel sort of hard.
It's absolutely hard. And I think, I met with doctors, I'm going to back up. I will say one of the most difficult transitions for me was going from pediatrics to adults. Pediatrics tends to be more warm, fuzzy than adults. And
all those pediatricians wear little stuffed animals on their stomachs.
and clown noses and but there were also doctors that I had as a kid who did both pediatrics and adults. And I think they sometimes also had trouble switching back and forth between the two populations. And you can tell the people who interact with kids every day and those who don't. And it's not a bad thing. If you're not used to talking with kids, I totally understand if that's not what you're used to. So it wasn't going from peds to adults and recognizing that this, not that it's not harsh. It's just, it feels more sterile because there's less color, there's less stuffed animals and clown noses, right? And there's less fun. I guess I'll say, that we have child life specialists and pediatrics, and there's a toy closet and, things that they try to make it as easy as possible for kids to be in the hospital. And for adults, it's just like, you're here.
Yeah.
Deal with it.
So, people hear stories of people going through 6 cancers or other sorts of very difficult experiences, and they sometimes have a difficult time understanding that there can be gifts in all of this.
Mm-hmm.
And I know this for some people might sound crazy, but what's been the gift to you in this whole crazy experience you've had?
In hindsight, because it's really hard to see the gifts when you're going through it. But in hindsight, I will say that I have been, for the last 26 years, incredibly amazed, impressed, and blown away by the kindness of community and the goodness of my friends and family and the people that choose, my family is my family, but the people who also choose to be in my life. And how their support just meant the world through everything. I have two of my best friends I met when I was going through chemotherapy in middle school that were both in my wedding. And they're still two of my best friends to this day. And it's, again, they chose me. They chose that. And they continue to be there for me throughout everything. And I know that they'll continue to be there for me if this happens again, if and when this happens again. So that's really been the gift, is just to see how truly good and kind people are.
Amanda Antonelli is a cancer survivor. If you have questions, the address is canceranswers@yale.edu, and past editions of the program are available in audio and written form at yalecancercenter.org. We hope you'll join us next time to learn more about the fight against cancer. Funding for Yale Cancer Answers is provided by Smilow Cancer Hospital.